mHealth4Afrika is co-designing a modular, adaptable and extensible multilingual framework that integrates electronic medical records and electronic health record functionality with medical sensors and data visualization tools. It will support the automatic generation of monthly program indicators, and it supports the adoption of technology at the point of care. mHealth4Afrika is co-funded by the European Commission under Horizon 2020. It's focused on supporting Sustainable Development Goal 3. It aims to assist primary healthcare facilities to increase the quality and impact of care through timely capture of information, systematic storage of important data points in the electronic patient record, and improved follow-up. Frequency of contact with a focus on prevention through the use of state-of-the-art technologies at the point of care, accuracy and quality of monthly aggregate program indicators, and access to educational materials for clinic staff and patients to improve skills. mHealth4Afrika is co-designed with Ministries of Health, District Health Officers, clinic managers and health workers in primary healthcare facilities in resource-constrained urban, rural and deep rural environments in Ethiopia, Kenya, Malawi and South Africa. A co-design process was undertaken from the project preparation. This has ensured regular interaction with the healthcare workers and the clinic managers, which has informed the platform iterations. Initially, a baseline study and needs requirement was undertaken with intervention clinics, and this informed the alpha system. As each iteration is ready, it's validated with the healthcare workers. This input provides assistance in updating the specification for the next iteration, refining the workflow and the user interface. The sensor readings to be captured were agreed in consultation with the healthcare workers and the Ministry of Health. The intervention clinics are agreed with the Ministries of Health and the District Health Offices. They're currently in North Gondar in the Mara region of Ethiopia, Bungoma County in western Kenya, Zomba and Machina districts in southern Malawi, and the Eastern Cape in South Africa. The beta functionality currently being validated by the health facilities includes a patient list, clinic appointment list, the ability to set up healthcare workers as system users with access rights associated with specific programs, and we're adding the ability to generate monthly program indicators and SMS appointment reminders. The patient-focused functionality includes a patient profile that provides access to summary data, risk factors, programs that the patient is enrolled in, and appointments and reports per program. The programs were validated and prioritised based on the requirement of the health centres. During the initial iteration of the beta platform, it was very clear that the health centres require a health information system that supports a patient to be registered once and then enrolled in multiple programs depending on their health conditions over a period of time. We commenced with medical history and maternal health. This was then extended to support up to 8 ANC stages based on updated WHO guidelines, delivery and postnatal. The health centres requested that we added additional programs including newborn and child under 5, family planning, cervical cancer screening and other medical conditions such as TB and HIV/AIDS, for which pregnant women may also be receiving services. One of the research objectives for mHealth4Afrika was to design a patient record framework leveraging some of the functionality of District Health Information 2, DHIS2 and Tracker Capture. The rationale for this was based on a significant number of ministries of health in Africa, including Kenya, Malawi and South Africa, are using DHIS2 as the back-end HMIS for monthly aggregate data. As a result of participation in mHealth4Afrika, the Ministry of Health in Ethiopia is now transitioning to DHIS2 as the HMIS for aggregate data. DHIS has two main modules, a statistical processing module for routine reporting of health data from health facilities, which is the majority of DHIS installations, and a single module tracker for individual patient information. It was therefore a conscious decision for mHealth4Afrika to research whether a patient-focused application could be built on top of DHIS to support a consistent data model to store and retrieve patient data, as well as support automatic aggregate monthly indicators to be generated based on patient data. Based on limitations identified with the web and mobile data tracker capture application, mHealth4Afrika has developed a custom application and user interface using Angular JavaScript to interact with the DHIS data model set up in DHIS2 via a web API. mHealth4Afrika has designed the data model for each program. These have been informed by analysis of paper-based registries and interaction with the healthcare workers, and each program has been verified by healthcare workers prior to use. The data model is configured in DHIS2, and this determines the program structure with its stages, sections, and rules. And the mHealth4Afrika custom application dynamically renders the data model for each program. We'll now look at some of the functionality of the beta system. When the nurse logs into the system, they come to the patient list. They can filter the patient list based on the programs that they have access to, and the clinic manager determines which program each system user has access to. So they can filter or they can search for part of a name. Now we're going to look at some of the programs. So here, this Pacific lady is set up as part of the maternal program. You can also see that she's registered for family planning, cervical cancer screening, and medical history. Here we've kept a similar block approach on each of the program pages. So it's a dashboard that provides you access to the patient information, the stages and the reports, appointments, and then visualization of data, including vital signs. So here we can see that this lady has been set up for all the appointments across the maternal health program, and she has attended most of the appointments. Here we get an overview of the patient, so we see the LMP, the EDD, and the number of previous babies. We have access to the stages. So for each stage, we can add data. So we can add a pregnancy test, then we add each of the A&C stages, delivery and postnatal, and then to access these stages that are complete, we just click on the name of the stage. Here we have access to visualization of the data that was collected during the stages. So the blood pressure across the 8 A&Cs and postnatal, temperature, then weight, abdominal circumference, SpO2 and pulse, and fundal height. So this gives the nurse a good overview of the development of the patient's condition across the pregnancy. We'll now look at another program. So here we have a child. So this child has attended all of the visits across the 5-year period. We have access to the latest growth and nutrition details based on the last visit, a summary of the immunization that they received. And then when we click on stages, we see all of the data that was input. So at birth consultation, each of the growth and nutrition visits, consultations or childhood illnesses, immunization visits, vitamin A and deworming. And then we have access to data visualization for all of across the visits. So in the case of the Child Under 5 program, we've set up visualizations based on the WHO graphs. So this shows you the reading for weight for age against the Z scores, the weight for height, length for age, and we've also added the NUC. This patient is registered for ART. So here we see the appointments that he's registered for. We see an overview of the risk factors that have been captured during his interactions with the health centre. We have an overview of the latest vital signs based on the last reading and the summary of his treatment as part of the ART programme. We can access the stages, so we can add a pre-ART or a voluntary ART consultation and then regular ART consultations. We have access to reports that give us the analysis across the different visits, and we have data visualization for blood pressure, temperature and weight. Then we also map CD4 results and the viral load results. So this allows the nurse to monitor progress. And here we have a patient who is registered in the tuberculosis program. So here we see his appointments, we see his vital signs. So this is the last vital signs from the last visit. Then the summary of his TB treatment. We have access to the stages. So we see the TB screening, then we see the TB consultation, and then we have access to the data visualization. So for blood pressure, for temperature, and for weight. Healthcare workers are using a range of CE-approved Bluetooth sensors at the point of care to measure SpO2 and pulse, an oximeter, blood pressure, temperature, sugar levels, temperature, weight, and hemoglobin. The mHealth4Afrika Android application interacts with the mHealth4Afrika data model to undertake user authentication. It retrieves and synchronizes the patient list. It displays the sensor readings using Bluetooth LE, and it passes the sensor reading to the electronic patient record using HL7 FHIR. The mHealth4Afrika consortium brings together multidisciplinary research and innovation expertise. Thank you for your interest. We look forward to engaging with you further.